Hello everybody, it's Martin Kiernan here. In this episode of Infection Control Matters, I'm going to have a chat to Professor Gonzalo Bearman, who works at VCU in
Richmond, Virginia.
Richmond, Virginia, yeah. I always get mixed up with that one. You're the Richard Wenzel Professor of Medicine there.
I am, hard to believe, but yes.
Yeah, well, actually I can believe it. Now, Gonzalo had a recent paper with colleagues published in ASHE, which we'll put a link to, looking at AI, and there's been a lot of discussion about the use of artificial intelligence in conferences recently. So we thought we'd have a bit of a chat about it, because you talked about taking the middle road. But can we start off by talking about what are the positive things? I don't want to be too negative to start with, because people often start with the negative when they're talking about it.
Right. I mean, one of the, just to mention the negative, there's such an underlying concern that AI will replace us or take our jobs, particularly for knowledge workers, whether it's infectious disease specialists or other knowledge workers.
Well, if you can get people to wash their hands regularly, I'd actually give it that job, to be honest.
That's a good way to look at it. So what I would say is the positive is we should embrace the things it can do for us and help us with. Examples in our line of work. Surveillance. If it can take away the nitty-gritty, day-to-day kind of grinding work of doing manual or partially manual surveillance, and it's good at it and accurate at it, by all means, do that so we can focus on other things. Other approaches or ways to use AI is you allow the chatbot or AI to help you summarize the new papers that come out, prepare presentations that you can share with your colleagues, even prepare presentations or materials that you can share with patients about patient care matters, infection prevention matters, et cetera. So those are all things that can make our work much more streamlined and efficient. So if you've done that, then you could actually focus on things that really matter.
I mean, that's a really good point, because often I'll write a patient information piece of booklet, right, but I'm writing in language I understand.
Correct.
But actually you can say, turn this into something that a person with a lower set of knowledge would be able to understand, and then you can proofread that. And that might be a way of getting better patient information.
Absolutely. You can even upload a manuscript and say, please translate this manuscript to plain English language summary.
Yeah.
And you get a very concise, generally accurate representation of what the manuscript is saying.
And let's make this quite clear, really. We're not truly talking about artificial intelligence here. We're talking about large language models which look for algorithms that way the words fit together, isn't it? So that's how, we should be too frightened of them, as you say, taking over.
Right.
Okay, so these are positive aspects. How can it actually help with surveillance, do you think?
Well, I think with the surveillance, it could help us. It was some nice presentations here in Jakarta on this, using the AI. Using AI to help us synthesize like unstructured data, going through or combing through the unstructured data and giving us a structured summary of the unstructured data, which can be used for surveillance. And that was done by one of our Korean colleagues at Samsung Medical Center. Beautiful presentation on that. They have a manuscript that's forthcoming. So they can take things such as surveillance, which is the collection of the data. So getting the electronic data that's structured, getting the data that's unstructured from clinical notes, for example.
Okay.
And then synthesizing and bringing them both together to come up with a diagnostic outcome.
Okay, so you'd have to be quite careful about uploading personal information, of course, wouldn't you? That's personalized it.
Right.
Yeah.
So that is one of the potential dangers. How do you safeguard the data? How do you keep at least the medical information truly private?
Yeah.
That's one of the challenges.
Because once the information's in these large language models, it's there, isn't it? You can't take it back.
That's my understanding.
Yeah. So it's a bit of it's almost a one-way street, really. Because once it's learned one thing, and of course it can learn not the correct thing. So
correct.
Let's have a chat about, what are the downsides of it then? Because I know people are quite concerned about, in universities, about people using it for their theses and people using it in structuring essays and that sort of thing. But we should be maybe concerned about publishing. And I know you're editor of an open access journal. How does this impact you?
Well, one potential downside is someone could claim work completely as their own original work. It's actually done by the large language model or the AI bot, for example. So that's a concern. Another concern is whether or not the databases from which the conclusions are drawn are actually high-quality databases or as free from bias as possible. And that's very difficult to detect by just looking at the output of artificial intelligence. In fact, there's some AI bots out there. You see this in the United States. They have like basically from right-wing databases versus left-wing databases.
Wow.
You get two different conclusions. Oh. So what really matters is really the source of the data.
Yeah. Okay. So I take it you're not looking as one of the authors of somebody called George Peter Kelly.
Exactly.
As an author.
Exactly. So, and publishers, I think, are struggling with how best to come up with an industry standards in which, when you submit a paper, as you certify that the work is yours, it's not submitted elsewhere.
Yeah.
The references are done in good faith, et cetera, et cetera. Soon we're going to be pretty much attesting that this is our work. This was not completely written by a large language model AI bot, or that if you use the bot for certain components, you at least specify what or how it was used.
Yeah, because people whose first language isn't English, writing for an English language journal,
correct,
may want to use a large language model to actually make the English correct before submitting it to the journal, because often it comes straight back anyway. You're going to need to rephrase all this.
One thing that I've noticed in writing is, let's say you write an essay, medical or scientific and non-scientific. You can write your essay, at the conclusion of the essay, upload it to the large language model, ChatGPT, for example, and ask ChatGPT to correct grammatical mistakes.
Yeah.
And it cleans it up for you.
Yeah.
It's still your work.
Yes.
But you've used assistance.
And I think, going forward, if you declare that's what you used it for,
correct,
I don't think there's any issue with that, really, is there?
I would agree.
It's when you get it to write a foreword for something, or a large section of your paper, which might be a little bit difficult because it won't have access to the references that you've used, presumably.
That's correct.
Yeah.
With limitations.
Are there any issues then with uploading, say, a scientific paper from a peer-reviewed journal that is not open access, and you pop that into you save the PDF into it and then ask it to analyze it? Because are you not breaking copyright by doing that?
So I think there is an issue. I think the publishers would have an issue with that. Because you're essentially taking copyrighted material, uploading it into a chatbot or a large language model, artificial intelligence, and that's therefore stored for later.
Yeah, it's gone.
It's gone, right? And it wasn't, I guess, properly obtained by the chatbot.
Yes. I mean, it's obtained properly by the person uploading it because they've got access to it. But that's, moving on in that way. But it's very difficult to stop that sort of thing happening if, as you say, people can upload a paper and get it to summarize, especially if you've got it to summarize, you don't speak English, but you want a summary coming to you in Spanish or one other language, you could do that.
So it seems like the line can be very fine between using the large language model or the chatbot appropriately, or then using inappropriately by way of copyrighted material, which you've not received actually the go-ahead from the publishers to use it for that function.
I mean, would publishers in the future offer their own version? If, say, I want to download a paper from ASHI,
right,
and you choose which language you want to come to you in, and the actual publisher would say, okay, we're going to allow a chatbot to actually convert this into Japanese or Spanish or Portuguese or whatever, and that way it does come from the publisher, but it's already gone through a chatbot. And that's because I wouldn't expect a publisher to translate a paper into every language around, but it would be a way of disseminating information a bit better.
You can almost envision that as these chatbots become much more, I don't want to say democratic, but more accessible and even cheaper to use and to maintain, that individual either services, third parties, corporations, publishers will have their own chatbot, and you're obligated or encouraged to use their chatbot. I mean, as it is now, you open up a function such as WhatsApp, they already have their own AI bot to help you with that stuff.
Yeah.
But Microsoft, they have their own. Google has their own, et cetera, et cetera.
Yeah. I mean, I personally found it pretty useful in planning me an itinerary. If I'm going to visit a city, and I say I've got a day and a half, what would I go and see from this location? Because that's where my hotel is.
Absolutely.
It'll give me an itinerary. They are very helpful.
Absolutely.
Okay, so we've talked about the really good and the really bad. What's your middle ground then? What are your recommendations?
The middle ground essentially urges infection prevention specialists, antimicrobial stewards to not run away from artificial intelligence, to actually get engaged. So get engaged, number one, by, if you're in an institution that is looking to integrate, for example, artificial intelligence in your electronic medical record, get involved in that. Get involved with IT and have some input. So that's one thing. Number two is, if you're at a higher level, at a government level, or even a professional society level, be an advocate and work through the professional societies to advocate for sound policies for the use of artificial intelligence for your particular profession. I think, and then another way to be engaged and not run away from the use of artificial intelligence is, while adapting and adopting the AI, so leverage at least the chatbots cannot do yet.
Yeah.
For example, they still can't make those values-based decisions. those morals and ethics-based decisions that generally can't lead, you can still be a leader in stewardship and infection prevention or infectious disease, such that you motivate and engage others, you recruit, retain individuals to your teams. That's not something that the chatbot's going to do. One can conceivably liberate their time from the day-to-day mundane things to focus on those kind of higher level functions of leaders in infection control and stewardship. So I think that's another approach.
Yeah, I mean, you could, for example, get it to write your policies and procedures for you. Absolutely. And you just modify them. You put in certain parameters and say, this is my setting. Please write me a guideline for that. You actually mentioned writing a policy for the use of ChatGPT. Yeah. You could ask ChatGPT to write your policy for the use of ChatGPT.
That's correct. It's a bit twisted, but I like the idea.
Yeah, I mean, presumably, because it might make a value judgment, it would probably come up with something that somebody else has already written because it's going to be learning from other groups.
Now, you've commonly heard in the infection prevention circles, and this probably applies also to stewardship, that, we would love to get involved in that project or push forward this new initiative or this new adjustment in our infection control practices, but we're so busy doing surveillance or we're so busy doing day-to-day mundane things. Well, if you can free yourself up from some of that, I mean, I'm not saying 100%, but maybe 20%, 25, even 30%. How do you strategically and deliberately use that time to really advance more important things in infection prevention? How do you change behavior across the health system? That takes, I think, human interaction. The chatbot's not going to do that for us.
Yeah, interesting. I mean, I found it useful in bizarre ways. For example, I was in Canada recently. I was talking to Paul Weber, how many teleclasses have you ever done?
Right.
And he didn't know. And they're not numbered on his site, but it's many hundreds.
Right.
So I was able to download the web page, and each single teleclass has got the word PDF on it.
Right.
So I just got to count the number of word PDFs.
Yeah. What did you discover?
And I said that you had 973 podcasts. Teleclasses. So you can make it work for you very easily. I mean, in your everyday life, are you using ChatGPT?
So I am in various ways. For example, I've used it to review manuscripts that we've drafted, to look at the grammar and those kind of things. I've used it to
ones you've done yourself.
Correct.
Yes.
Correct. I've also used it to summarize a couple of papers, like for a journal club that we do with our fellows or trainees. I guess it would be registrars in the United Kingdom in infectious disease. That's been very helpful.
What instruction would you give it then when you were doing that? Just analyze this, or can you focus on this, or this is coming to a professional audience? What question would you ask?
So generally, the questions I ask if you're uploading a manuscript, a scientific manuscript, is summarize the findings. Go very broad at first. Summarize the findings in this manuscript and see what it gives you. Okay, this is obviously you have to read the manuscript yourself.
Yes.
So summarize the findings. That's number one. Number two is give a plain language summary of the findings. The reason I say that is I play a little game with our trainees when they present these journal club articles. I say, let's play the medical reporter game.
Okay.
I'm a medical reporter from the local news station, and you've written a paper, or this paper, and I'd like you to explain to our audience, which is the lay audience, I'd like you to explain to our audience what you found in this paper and why it's important. And when you do that to medical professionals, particularly those who have not had media training, they really struggle.
Yeah.
They really struggle. So, I say this is your response, it's the chat response.
Yeah.
Let's see what we find.
That is interesting because actually I find if I'm talking to non-infection preventionists, I've got to change my language. We're very good at talking to each other. And actually that might help us phrase what we're trying to get over to our target audience a little bit better than we are at the moment.
Right. It can help one focus the discussions or the conclusions that's more suitable for our target audience.
Yeah.
I think we as doctors, as physicians or infection prevention nurses, sometimes we're too technical.
Yeah.
And it doesn't really resonate not only with the lay public, but sometimes with our own staff or our hospital staff. You're getting too technical and you lose their interest.
Yeah.
It's very difficult for people to say, in this study that was done in X hospital, by doing this intervention, they saw a 30% reduction in such and such. Just keep it simple.
Yeah.
Keep it very simple.
Yeah. And they're the best messages to go over. Any other examples you're using in your own everyday life? I'm not even professional, for example.
Oh, I mean, I think what you mentioned earlier is like I'm going to so-and-so. I have a day in New York City. What are the top things you recommend?
Yeah.
So it can give you some advice that way.
Yeah.
And then, you can get very creative. In music, for example, you could certainly have the ChatGPT summarize the latest music on the airwaves in North America. Yeah, and see what it shows you.
Yeah. Yeah, okay. Being creative. I actually like the image generation as well. I use that a lot myself. And if you're quite descriptive about what you want, you can get some amazing pictures out of it.
Yeah, but we haven't even explored that yet. So one of the things we try very aggressively to encourage our writers, or our authors, I should say, that publish it actually is to give us a nice visual abstract.
Yes.
Now, that is something that's so powerful.
Yeah.
If you have a proper visual abstract that can convey the why, the how, the why it's important, et cetera, of your manuscript, then that can double, triple, quadruple the reach of your audience. So using chatbots or ChatGPT or artificial intelligence to help us with that, I think would be hugely, hugely.
Is that possible at the moment? Because I know you can generate a picture, but I'm not about it.
No, I've never seen. I have not seen a visual abstract yet, but I think that's certainly not insurmountable.
No, that's great, can it?
I mean, come next week for all we.
Yeah, it probably is there, and we just haven't spotted it.
So right now, in all transparency, if you submit to ASHI, we give you instructions on how to create a visual abstract.
Okay.
It really falls back on the author.
Okay.
You don't have a productions team that's doing it for you.
No. Okay.
Now, what if you had a reliable, reasonable, accurate chatbot that could do that for you, and you claim that it was done by the chatbot? I don't really see an ethical problem.
I don't have an issue because it's taking your information. So presumably, if you give instructions to authors how to create a visual abstract, if you put that into ChatGPT,
I'm sure it could learn how to do it.
And then said, here's the paper, pick out similar points to what we want in the visual abstract, it would be interesting to see what that came up with.
I think you just come up with a brilliant idea. We're going to try to test that out.
Okay, well, it's been fascinating. Thanks very much for the time. And it's definitely going to help us. We just got to be careful that it doesn't do any damage by using it in an unethical manner. And, uploading papers that aren't yours and sharing patient information are absolute no-nos, aren't they?
Absolutely. We don't want it to be our Frankenstein.
Yeah. Absolutely.
But I think there's a lot of positives and benefits, potential benefits. And really the time is now for us to embrace it, to be leaders, and really not to run from the adoption of artificial intelligence in medicine.
Okay. Thanks very much, Gonzalo.
Thank you, sir. Always a pleasure.